warm up the whole of the lower back first with effleurage, and then I'm going to friction across from the crease of the buttocks along sort of the towel line out to the head of femur and back again. So working to the client's pain threshold, 1 to 10, what sort of pressure is that for you? Okay, so that's quite high already. A 7 is really the ultimate. We don't want to go higher than a 7. 7's a sort of pleasurable agony. It feels as though it's doing you some good, but it's definitely a bit uncomfortable. So we're going to friction this area well. As you remember, friction's an analgesic. So it's good to warm up with effleurage, frictions, and then some petrissage. So we're going to knead the whole area, warming it up from the waist down to the towel line. So on the love handles, using a variety of kneading moves. And then we're going to palpate a little bit. Not always do people know whether there's any tenderness or not. So can you feel anything coming through here? Okay, so I'm going to use quite a firm palpation across the whole of the upper glutes, right the way up to feeling the pelvic girdle. So frictioning along the pelvic girdle, finding the sacrum, frictioning along the sacrum, just sort of to investigate this side. And I normally find that people, if there's pain in one side, there will be pain in the other side as well. So one side might be worse than the other, and if people are aware of discomfort, then you would do the good side first so that you can compare one side with the other. So if I'm going to go down now into the lower back, I'm going to pull this towel up, and I'm just going to pull this towel back. So at no time are you actually exposing the crease of the buttocks. A little bit more oil. And there are a few no-nos, as I said in my presentation. You know, you never expose the crease of the buttocks. You certainly don't pull the cheeks of the buttocks apart. You would discuss with your client before pulling their pants down that you're going to go into the buttock area if it's required. So again, we're going to effleurage this far side. I find it so much easier to work on the other side of the couch initially from the area I want to work on, just to get a little bit of distance and help me to have a better position. So I'm going to warm up the whole area with effleurage first and kneading. Lots of petrissage to warm up the area. Maybe some heel of hand. And some knuckling. And generally I find it's right in the middle that can often be tender. How's that? Yeah. I feel that. So if you think that this is a sort of target, this is sort of the bullseye right in the middle. So you often find that that is a key trigger point. So I'm just going to warm it up though, frictioning, find the head of femur. I'm going to friction and come up from the head of femur along tensor fasciolata up to the top of the pelvic girdle. You can feel it's a bit crunchy and lumpy along there. Is that tender as well?
Yeah.
And then we're going to follow the pelvic girdle along. So finding your bony landmarks, follow it along till I come to the sacrum, and then I'm going to friction, and you can see that it's a bit tight here. You've got your red flags coming up straight away to show you that there's been a lack of blood supply, lack of nutrients in that area. So I'm frictioning along the sacrum. And then I'm going to come across the sacrum towards the head of femur, which is coming across the piriformis. Now, we've got all these ligaments that are across here, but it does tend to be the piriformis that gives the most amount of problems in there. Is that the right spot? So I'm just going to knead and warm up a bit again. And then I'm going to come round the other side, having warmed it up really nicely. I'm going to come round and warm up from this side, getting ready to do some trigger pointing. So I'm going to start with my trigger pointing probably in there. And because this is the piriformis muscle, what it does is it laterally rotates the hip. So I'm going to laterally rotate the hip by pulling the leg across and then back. And I'm going to move it from side to side. How does that feel? And then move a little bit closer. And I can feel the piriformis underneath, just twanging underneath my thumb. Can you feel that? And then we're coming across a little bit more. And we're heading, twanging, heading for the head of the femur. If you find that you want a bit more pressure, feel free to have a knuckle, especially if your thumb's sort of twanging off it. How's that? So always just getting a little bit of feedback from your client on the pressure. You don't want them gritting their teeth, sweating into their face hole, thinking I'm never coming back. You want to have good feedback. And one of the main criticisms of sports massage is nobody warms it up enough. They go for the jugular and do trigger pointing before the client's ready. So this is a soft tissue release. This is lengthening the muscle fibers. So we're going to move and then move the foot in and out, which is laterally rotating the head of femur, laterally rotating the hip. And then we're going to move from the sacrum, the origin, across towards the insertion. And we've warmed it up really well, so we're going to pop the leg down. And then we're going to find our trigger points. So how about that one in there? Yeah? Now, this can be quite firm on your thumbs, quite a lot of pressure on your thumbs, so you might want to get your elbow in. So we want a supported elbow. We don't want to have all our body weight on the elbow and then find we slip because of the oil. We want control. So how's that pressure? Okay. All right, so breathe in and out. Get your client to breathe deeply. Hold on to the trigger point. Have your weight spread between both feet so that you've got good control of your own body, and the elbow is coming in that way rather than down that way. The client should feel that the pressure's coming down and the pain is releasing. What number is that now?
5, 4.
That's a 5 or a 4. Okay, so we're not going to rush to take it off as soon as there's some response. We're going to hang on in there and see if we can get it down a bit lower. But obviously we're not going to hang on to it forever. And we're going to take it off nice and quickly and then effleurage it down. So I'm just going to go for one more, a little bit lower. What about there?
Yeah.
Is that all right?
Yeah.
What number is that?
6.
About a 6. So we're going to hang on to that. So I'm a little bit closer to the sit bone now. So where the hamstrings attach. And this can often be a complication of the lower back, is that the hamstrings are tight and pulling on the ischial tuberosity. What number is that?
4, 3.
Okay, so I'm just going to go a little further right on the sit bone now. There. How's that?
6.
Painful?
Yeah.
What number?
6.
6. So yeah, I can just feel just a little bit there. And you do learn to feel as much with your elbows as you do with your thumbs and your fingers. If you practice this, you can feel the muscles twanging or moving underneath. Feel the tension. What number is that now?
3, 2.
Okay. So then we're going to effleurage it out. Maybe friction a little bit more around this upper pelvic girdle, which looks a bit stuck, doesn't it? Is it painful there? So I'm going to do a thumb trigger point, breathe in and out. What number is that? 5, 4, 3, 2. And I'm going to effleurage it out. So having worked on this side, I'm going to pull the towel across so that I can then do the other side.